Hey guys, welcome back to Scanning the Mind. Today we're going to be talking about one of the most common psychiatric conditions that affect people all around the world, depression. We're going to cover what depression is, who it affects, how we treat it, and what the future might look like for someone who suffered from depression. For those of you who don't know me yet, my name's Sanchit, I'm a psychiatry trainee in the UK, and if you want to know a bit more about how I chose psychiatry and my journey into psychiatry a little bit, I'll link a video up here just now. Depression is a very common, yet at times very serious mood disorder. People suffering from depression experience persistent feelings of low mood, and with some of the other symptoms being anhedonia, which is the inability to feel pleasure. Now usually this presents as people being unable to enjoy things they used to enjoy, such as seeing their friends, playing video games, watching movies, poor sleep, or even at times too much sleep without feeling refreshed upon waking, a reduced appetite, and poor motivation and poor concentration abilities. Alongside these symptoms we've talked about, there's a whole host of other symptoms that can be part of someone's depressive illness. Sometimes when depression gets particularly serious, people can start having thoughts of maybe wanting to harm themselves or even wanting to end their own lives. People who've started to have these sorts of thoughts require treatment and support as a matter of urgency. Like I said before, depression is a very, very common condition, and in the UK, roughly 13% of people will have suffered from a depressive episode at some point in their lives. It's more common in women than men, and for the people between the ages of 18 and 44, it's one of the leading causes of disability and premature death. No matter who you are, how much you earn, or what kind of job you have, depression can affect anyone. There's absolutely no shame in seeking help if you think you might be depressed. If you thought you'd broken your arm, you wouldn't just walk around with that without getting any support now, would you? Like with everything in psychiatry, we generally break down the management of depression into three main areas: biological, psychological, and social. When we're looking at the biological treatments for depression, we're generally talking about antidepressants. The psychological aspect of treating depression usually centers around psychological therapies such as cognitive behavioral therapy, or CBT as it's more widely known. The social aspect of managing depression usually includes offering social interventions to people suffering from depression and even sometimes their families. So if we look at depression in this biopsychosocial model, people with mild depression are generally successfully treated by their GPs and rarely come and see a psychiatrist. Mild depression is usually managed with either a careful 2-week watch and wait approach, or with referral to psychological therapies like we've talked about, like CBT. Moderate to severe depression requires slightly different management. Usually incorporates both the psychological aspect of treatment, so referral to something like CBT, alongside medication called antidepressants. The initial antidepressant of choice is from a class called selective serotonin reuptake inhibitors, for example, sertraline, fluoxetine, or citalopram. Usually the choice of medication is tailored to that individual person. Some medications are more sedative than others, which can be a benefit if you're suffering from poor sleep. Some medications might be better for people with heart problems, or some medications may not be able to be prescribed with people taking certain other medications. So it's a very tailored approach according to the person sat in front of you at that time. If the patient doesn't respond to that initial treatment with antidepressants, there are a few other things that we can do. Usually this is either trying different antidepressants or different classes of antidepressants, combining antidepressants together, or trying other medications such as lithium, and in its severest form, you can also try something called ECT. Interestingly, at the moment, there are some current studies being done into psilocybin and ketamine in the treatment of depression. Don't try that at home. Untreated depression usually lasts anywhere between 6 and 13 months, with that reducing to just 3 months if it's treated. More than 50% of people recover within 6 months, and 75% go on to recover within a year. Unfortunately, the likelihood of recurrence with depression is quite high, and the chances of recurrence increase with every episode of depression that you have. If you've got any questions for me, leave them down in the comments box below. If you think you might be suffering from any of the symptoms we've talked about, please go and see your GP and get the support that you need. If there are any other psychiatric conditions or things that you'd want to learn about, please let me know. But other than that, thanks for watching and I'll see you in the next one.